Hello, this is Karen Richardson. I'm going to talk to you today about bone fractures and repairs. First, I want to tell you that when bone is broken, the ends have to be realigned before they're going to heal. So the term for this is reduction. Now, if you have to have cast and they realign the bones and no surgery is required, then we're going to call that a closed reduction. Whereas if the patient requires surgery, we call that an open reduction. And in this case, they're going to go in, place any kind of pins, plates, anything to help hold the bone together during the healing process. Now, bone, just like any type of tissue, has to go through a progression of steps in order to replace itself. So the first thing that's going to happen immediately after the break is you're going to get damage to the periosteum. Blood vessels in the periosteum are going to break, causing bleeding. There's also going to be damage to the bone itself. And as we know from learning about the parts of bone, bone is very vascular, it has a rich blood supply. So there's going to be a good amount of bleeding, which is going to cause a hematoma to form, which is, of course, a blood clot. This is going to occur, of course, within the first few minutes. Within the first week, you're going to have the formation of a granulation tissue. You will have tiny little blood vessels that will be growing into this area, providing nutrients and oxygen. You will also have fibroblasts that are going to grow into this area and start laying down collagen fibers. You will also have some of these osteogenic cells that lie on the inside part of the periosteum. They're going to be stimulated to differentiate into osteoblasts and chondroblasts. Now the chondroblasts are going to start laying down cartilage. And as we know from learning about endochondrial ossification, bone follows cartilage. So this area here is now full of cartilage, and we call that a soft callus. And this is going to be in place about the first week after the break. Now, after that, immediately, soon, the chondroblasts have laid down the cartilage, and now there's going to be formation of spongy bone in the place of the cartilage. So we call this the bony callus or the hard callus. And this is going to last for several weeks. Of course, during this time, the patient's going to be in a cast. So the type of bone that's being produced, though, is trabecular or spongy bone, which, as we know, is not present in all the different places within the bone, especially right toward the outside. So over the next several months, anywhere varying depending on the patient, you're going to get remodeling that has to occur. This outer edge, the osteoclasts are going to come in. They're going to remove the trabecular bone and lay down compact bone. They're also going to change the appearance of the bone inside the medullary cavity. And they're also going to be removing any dead parts of bone, any cells that are no longer living. So in the whole, it's going to take quite some time, and that's going to vary depending on the patient. Patient's age, patient's overall health. Some of the elderly are going to have poor circulation. They may have osteoporosis. You're also going to vary depending on how bad the break is. Some breaks are much harder to repair, and of course some might have required surgery. Now, we can describe these breaks in several different ways, depending on the position of the bone, the type of the direction of the break. Now, this first descriptive term is whether or not the break went completely through. So on this one, you can see that the fracture went from one side of the bone to the other. It completely broke. Whereas if you look at this one, the fracture did not make it through to the other side. So this would be an incomplete break. Now, sometimes we refer to this as a green stick fracture because if you think about a young twig or a green branch, it's hard to break completely. It won't snap. So it will kind of bow or bend, and part of it will break, and therefore the name green stick. Now, these can happen in younger patients. Children's bones are a little more flexible, so they're not going to break completely through sometimes. Another way of describing it is whether or not the ends of the broken bone are still in place. Obviously these are still in place, so we would call that non-displaced. This x-ray is showing you a displaced fracture in which the ends are nowhere near each other. Another way of describing a break is the direction that the break took. Now this one in the center is a linear break, and that means that the direction of the fracture is the same as the long axis of the bone itself, or you can think of it as going lengthwise of a long bone. Now, another term, sometimes this is also called a fissured break because it is a incomplete break that runs the length of the bone. Now, a transverse break is a break that runs perpendicular to the long axis of the bone. A spiral break, this occurs, it looks like a more of a diagonal type or oblique angle, but what's happened here is more of a twisting motion. The bone was subjected to forces at either end and twisted, and sometimes this type of break can be a red flag for child abuse because an adult might have taken a child's arm and twisted until it broke, and that can cause a spiral break. Another type of specific description is an avulsion, and in this break it's actually where a bone is being broken, but this small piece is attached to tendon that is connecting the muscle to the bone. So the break occurs there, and this is a break that can happen sometimes with weightlifters who are trying to attempt too much weight. It can literally rip the bone off of each other. Now, a comminuted fracture, this is a fracture that has occurred where there are many pieces, at least 3 or more. And you can see this fracture with this x-ray. This patient's going to have a much harder time healing. This would require surgery. They're going to have to go in and stabilize these pieces because these pieces are missing from where the bones are going to have to realign. So there's going to be a substantial gap between the ends of the bone. So this is going to be much harder to realign and to heal. A compression fracture, this is a nice picture showing a vertebrae that has suffered a compression fracture. And in this, the forces are coming from both sides, pressing on the bone. Now, an easy example of this would be an elderly patient who has osteoporosis. Their bone has become very brittle, and just the weight of the gravity, the forces of the gravity in their body weight, can cause the vertebrae to literally compress. And this is one reason why you may notice that elderly family members seem to get shorter with time. Now, a depressed fracture, this is seen with skull fractures in which some type of force actually presses the bone inward, like a crushing force into the skull, and creates kind of a cratering effect on the bone. That would be a depression fracture. An epiphyseal fracture is in which the epiphyseal plate is actually separated from the diaphysis of the bone, and this is a fracture that can be seen sometimes in young people that are attempting to lift weights that are too heavy for them. This area is not quite as strong. It's cartilaginous tissue that is becoming bone. So you may see a break that occurs at the plate itself. Now, the last descriptive term is whether or not the bone pierces the skin. So if we have a break in which one or more pieces of bone breaks through the skin, that would be called a compound fracture, sometimes called open. Now, the danger of this is, of course, that bacteria can get into the wound. It's much more dangerous than a closed or simple fracture in which the skin is not broken. And here would be the simple fracture. Now, with these fracture descriptions, you can use more than one thing for one fracture. So if I go and I look over here at this one, obviously we know that's a compound fracture, but I can also describe it in some other terms. I can say that that's a complete fracture. It has completely broken through the bone. It is displaced. The ends of the bone are no longer aligned. So we can call that other description words besides compound. Now, if we look at these fractures up here, that is a comminuted fracture. There are several pieces involved. But this one is a simple fracture. It has not gone through the skin. You could also say that this was non-displaced, because this one hasn't, the pieces are still in alignment basically. So whenever you look at these fractures, you should be able to use more than one term to describe them. So that's all I've got today. Thank you very much.